Hello, do you know what is pregnancy? Of course you know, but I'm here today telling you the signs that you may know you are pregnant. For the probable signs of pregnancy, one is amenorrhea. Amenorrhea means a situation where you don't receive your monthly periods, and this is only a possible sign, not a qualified sign, because you might be having some other problems in the body. For example, you're having stress, you're having a certain condition disturbing you, and you've not received your menses. Or at some point, there are some meals that you might take and prevent your menses coming. And some friends normally say when you take chocolate, maybe, I've used the word maybe, not validated to everybody, you might receive your menses. Also, skin changes. You might be having some stretch marks and hyperpigmentation of the skin. That is a possible sign of pregnancy. But you might be having melanin disorders, which might cause this. Another factor is breast changes. You might be having some tingling sensation in your breast. You know, you're just sitting down and you're feeling the tingling sensation in your breast. Actually, this is brought about by increased in blood supply in your breast region. But this might not qualify you are pregnant. It is only a possible sign. Morning sickness. Morning sickness, it might be accompanied by nausea and vomiting, or only nausea, and it subsides as the day gets old. You know, if you're having a GIT condition, for example, gastritis, you having peptic ulcers, you having gastroenteritis, you might be having nausea and vomiting. Another sign is quickening. Quickening is where pregnant women at 20 weeks or from 16 to 20 weeks normally say they're feeling the child is moving around. But you might be having quickens when you are stressed and when you are feeling perturbed or having a lot of anxiety, you know, having butterflies and wind in the stomach. That is another factor. And we have possible signs and we have probable signs. These are 95% suggestive that you are pregnant. So one of them is positive pregnancy test. So within the second week when fertilization takes place, this hormone called the HCG hormone, which qualifies that you are pregnant. This hormone, by the way, is released as early as 2 weeks. So when a diagnosis is made through maybe urine or blood test to check that you are pregnant, this hormone is always available. And remember, you might not be pregnant because when you're having some conditions in the body, for example, having a tumor in the uterus, it might cause this release of the HCG hormone. Or maybe when you're having identiform mole, it might bring about the release of this hormone. So that does not qualify that you're pregnant. You know, another one is uterine growth. You're just feeling your uterus has just grown. When you're having some tumors in the uterus, definitely there's something foreign has grown in the uterus. So this might bring about the uterine growth. Another factor is pulsating of the fronicles and maybe bluing of the vagina. Bluing of the vagina is also a sign where there's increased in vascularization in the vaginal area. So this increase in vascularization might bring about the bluing of the vagina. And there's also softening of the cervix. This is also a probable sign. And we have the last one, is the positive signs of pregnancy. These are 100% suggestive that you are pregnant. You know, one is palpation of the fetal parts. When you visit your nurse or your doctor in the clinic, they palpate and hear that there's something inside there. Those are good news. It qualifies you are pregnant. Another one is visualization of the sac. This sac is where the heart rate of the baby are seen. The amniotic sac and the gestational sac, they are evident. This qualifies that you are pregnant. Another one is auscultation of the fetal heart sounds. When you go for ultrasonography, a Doppler exam, it might show there are some heartbeats which are evident. This qualifies that you are pregnant. I hope you've enjoyed the lesson. Those are the three categories of signs of pregnancy. Thank you so much. Thank you for watching, and God bless you. Share it widely.